it is possible that you have hearing aids fitted appropriately and you're still struggling to understand. That doesn't seem fair. You've invested in hearing aids, you've got a great professional who's doing everything right, and yet there are situations where you still struggle.
It doesn't seem fair.
And it's unfortunate that hearing loss is a progressive neurologic condition that is incurable.
Wow.
We can't cure it.
Yeah.
We can help it. Almost all the time we can help it. But some people have hearing losses where the problem lies with the auditory nerve, with some of the auditory processing centers of the brainstem, or even the auditory cortex. If the brain is not processing sounds correctly, it makes it really difficult. You will hear the sound, and the hearing aid that you're wearing will amplify it and get you hearing it at an appropriate level. But if the brain isn't processing it correctly, it will still come through somewhat distorted. And that's a hard reality, but for many people with hearing aids, the sound never is quite as clear as we wish it was. And it does require things like altering the way you communicate with people, using what we call effective communication strategies. And sometimes it even involves using assistive listening devices, things that can help. But that's another reason why sometimes people with hearing aids can hear but not understand. Their system just doesn't process the sounds as well as we'd like it to.
Yeah, what a great point. Because we're playing sound through their system, not ours or their wife's or their husband's. We're playing sound through their ears, and then their ears are sending the signal up the nerve and into the brain. And we do have strategies, effective communication strategies, and other strategies that help clean the signal up, to help the speech become more enhanced and the noise floor to be more reduced. Kind of a cheating method that requires something beyond the hearing device for some people. Luckily, this idea, this kind of gloomy feeling of, oh, I invested in hearing devices, but I'm not as successful as I should be because my brain just doesn't process. Those patients are not nearly as common as patients who can wear hearing devices and be very successful. But there are patients who wear great hearing devices and they're not as successful as they should be. And so come in, meet with a professional, meet with someone who can talk to you about how do we enhance the signal and kind of try to separate the signal from the noise even more through different assistive devices that work in conjunction with your hearing device. So kind of a pairing or partnering. You've got the hearing device as one treatment option, and then you have some other things that you can do to really make that hearing device work its very best for your personal situation or your personal listening environment. So
yeah, there's lots of things that can be done. And I think this also kind of speaks to this idea of having realistic expectations. And I think a good audiologist, a good professional, will help you understand that your hearing aids are going to make a big difference.
Right.
And we're going to have discussions about effective communication strategies. We're going to employ these other assistive devices that are going to help beyond what the hearing aids can do alone. But even knowing all of that, we're not expecting perfection.
Right.
We're expecting to take you from a pretty low level to a pretty high level, but maybe not up to that perfect
100% level, yeah.
And so having those kind of tough conversations, but getting those realistic expectations of, okay, I'm going to do so much better. I'm going to hear things so much more clearly. I'm going to be so much more successful than I've been, even though there will still be these moments in these busy restaurants where I'm going to say, I missed that. Darn it, I missed that despite all I'm doing.
You know, there's a huge difference too. Here we are talking about this patient that we're referring to will never be 100% in all the environments. But you know how much joy they feel and experience when they can take 3 out of the 5 environments and they're like 50% better.
Yeah.
It may not be 100%, but now instead of functioning at a 20, 30% level, they're now functioning in a 60, 70, or 80% level in that one environment. They are so happy.
Yeah.
And so it's all about taking the time to make sure the expectations are realistic and the ability to try, to keep trying, to keep working. And that's a really important part is time.
Yeah.
Spending time with people so that they do well, you know, in these environments. And so talking through listening environments is a big part of helping people be happy and helping people be successful. Because when you're winning and you're more successful than you used to be, it does bring joy, it brings happiness, and that's one of the most exciting things about what we do, is bringing a different level, an elevated, almost like an elevated level of life back to that individual. It's really exciting.
Yeah, because we do not mean to say that it's hopeless, that you're never going to understand well, even if you're wearing the hearing aids. That is exactly wrong. Right. We can help people, and we do help people, and it's wonderful to see them improve in so many different environments. And so if you're struggling, just know there's help for you, even though it may not ever be perfect.
That's right. And most of you, and probably we should say the great majority of you that are watching this, you probably have a lot more hope and a lot more to expect, and the feeling of being way more successful or significantly better than you currently are doing. It probably comes down to a physical fit, or a wax clean, or a different size of wire, or the device needs to sit in a different way on your ear. You know, we're very picky, obviously, as professionals in this field of trying to help people hear their best. We're very picky about how things sit, the physical fit, the way they're programmed, the way the computer is telling the device to output in certain environments. We're going to be going through all the listening environments with you and helping you be as successful as possible. There's great hope for all of you. And you know, once in a while we get a patient who has ears that are, you know, completely shot, and it's very difficult. And even those patients walk away saying, thank you. You know, I'm doing much better than I was. And you might be thinking, well, you're far from 100%. But the fact that you were able to help them 10%, 20, or 30% better in different environments, it means the world to them. Okay, everybody, we so appreciate you watching the video today. If you've liked what you've seen, please like it, subscribe to our channel. It means the world to us, but it also means the world to other people who are trying to figure out what's going on with their hearing health. So thank you for watching.